Diagnosis and Treatment of Gastroesophageal Reflux Disease by Raul Badillo and Dawn Francis. Symptoms and Epidemiology. The diagnosis of GERD in adults can usually be made clinically. Heartburn and regurgitation are the most reliable symptoms in establishing the diagnosis, identifying up to 70% of patients with GERD. Chest pain is also indicative of GERD once a cardiac cause has been ruled out. In patients with atypical symptoms such as dyspepsia, epigastric pain, nausea, bloating, and eructation, a good clinical response to a proton pump inhibitor (PPI) may help establish GERD as the diagnosis, but should not be considered definitive. Gastroesophageal reflux disease is now the most common upper gastrointestinal disease in the Western countries, with 10% to 20% of the population experiencing weekly symptoms. In Asia, the prevalence has been variously reported but is generally lower. A limited number of studies have reported GERD and its complications to be rare in Africa.